dog attacks caught on tape.
I could see him ripping my arm, and I could see the blood on his face.
And how a simple paper cut almost turned deadly.
It was a flesh-eating bacteria eating through all of the tissue.
Plus, Red Run and his wife Justine open up about their biggest relationship battles.
Does he have anything he does that tests your faith?
Coming up next.
Season 11 starts now.
Today's show contains content meant for mature audiences. Some of our discussion may be inappropriate for teens and young children.
We love dogs on this show. I always look forward to playing with my dog, Khaleesi. But what happens when a man's best friend bites back? Right? That's the question today. 4.5 million dogs are biting people, and they occur every year in this country. That's roughly 1 out of 70 people being attacked. And many of these attacks are caught on tape, giving us insight into those terrifying moments when a canine goes on the attack. Take a look. Not all dogs come with a warning sign. It can take seconds for canines to go from cuddly to attack mode. These dogs were not afraid to go head-to-head with the authorities as they ripped off the bumper and chunks of the tires in an apparent fit of road rage. In Minnesota, a woman was knocked down and bit by a dog while taking out her garbage. Some dog bites can be fatal. There have been hundreds of deaths from canine attacks in recent years. Terrifying surveillance video captured a woman getting attacked by a pack of dogs on her front lawn. And what about a dog in your own home? This woman was violently attacked by a dog in her own living room, leaving her with stitches, scars, and a harrowing question. What caused this aggressive outburst? Sabrina, who you just saw on the tape, joins me now. Thank goodness you're okay.
Thanks.
You're a dog lover.
I am.
And this dog that attacked you, though, was not your dog. How did you come in contact with it?
No, I was driving around in my neighborhood, and like I said, I'm a big dog lover. So I saw this dog, and the second time I saw him, I stopped, and it took a little bit to coerce him into my car, but I got him, and I took him home, and I gave him a bath. And the next morning, I went to see if he was chipped, took him to my vet's office, and he was. So I found the guy on Facebook, and he had moved to Peru and left his dog with a friend, and he ended up on the street, and that's how I came with him. So
you agreed to keep the dog in your home. You made it a part of your family. You slept in the same bed. All the things that an owner does with their pet. When did the behavior begin to shift?
So after about a month, it was a Thursday, and when I wasn't home that day, my cat got out, and my dad came home, and he had killed the cat. He had killed the cat. And that's very tough, and it's very hard to speak about, and that's the guilt that I deal with today. But I called the owner, and I said, I need you to have someone come pick him up. And he said, wait till Monday, and this was a Thursday. And then I got attacked on Saturday.
What prompted that attack?
So I was in my living room, we were all in the living room, and him and my 15-pound Pekingese got in a scuffle. And it was right next to me, but I knew this dog was going to kill my dog. He was 90 pounds.
Yeah.
He was 90 pounds, and he was going to kill my Pekingese. So I was right there, and I was trying to separate them, doing everything I could. And the dog changed in a snap, and I became his target.
You can see in this video that the dog locked his teeth into Sabrina's arm, was not letting go, dragging you around. What was going through your mind while he's attacking you like this?
You know, you almost kind of don't realize it's happening. It sounds crazy, but in my mind, I was thinking that he'll bite me and then let go. Like it was just something quick. Mm-hmm. But after a couple seconds, I could see him ripping my arm, and I could see the blood on his face.
Your blood.
My blood on his face. And he was trying, before he locked on my arm, he was trying to bite everywhere. So he took a chunk out of my leg.
Oh my goodness, I can see.
He took a chunk out of my leg, and...
This is a graft?
No, this is the graft.
Oh. Yeah.
Yes, this is skin from my thigh, and he ripped it all apart. He took a chunk out of here. I didn't even know he had taken a chunk out of my leg. But when he was on my arm, I started punching him, trying to get him off of me, screaming, trying to get him off of me. But of course, he just saw red.
That's the wound that the dog made right after
Yes.
they treated it. These are, I'm sorry, gruesome to show people.
That picture is actually even like not as, there was worse. It was all open and really, I can't even look at them. They're so bad.
I didn't want to use them for our audience either because they are too gruesome.
Yes,
At least these images, I hope, will share how severe this is without becoming too grotesque for the person watching to pay attention. But I want to point it out because the dog bit and does not let go. The dog bites and tears off.
Tears. As he has his jaw locked on me, he's moving his head around, just like, you know, I became the prey. So.
How did you get this dog off you? It would have killed you.
Okay, so my dad was home at the time, but he was outside mowing the grass. He could not hear me screaming. So he was right outside when I opened the door. He grabbed a broom, started hitting him. He let go, but then I ran inside.
There's the broom. Look at this.
I ran in, so I ran back inside, and the dog stays coming after me. He was obsessed with just attacking me.
Oh my goodness.
And next thing I knew, the ambulance was there, but they couldn't get to me because they had to go through the front door.
The dog's there.
And the dog is there. So I crawled through the window because there was no other way they were going to get to me, and I could have bled out. I think.
As a doctor, I'll tell you, you could have bled out.
Yes.
With that injury?
And this as well, and I didn't even realize this was happening.
You didn't damage the nerves or?
Yes, the tendons were like hanging on by a thread. And my doctors did amazing work and were able to save my arm. Save my hand, actually, not my arm, save my hand.
I understand there's a silver lining around this tragedy.
There is. So obviously, the months after this happened to me, it happened to me February 9th. And the months after I was in therapy, I was bedridden, and I had to do all those things because when my hand was in a splint for like a long time, and when it came off, I couldn't do anything. This was me trying to move my hand. Okay. It's not moving,
right.
So I couldn't do anything. I went to therapy, obviously, and it impacted my life. I know what it is to not be able to do the most simplest things, you know, take a shower, get dressed, put on shoes, drive. I know what it's like to not be able to do those things. And I am now in school to be an occupational therapy assistant. So yeah.
You can do what they did for you.
I can.
Thank you for sharing
Thank you so much. Thanks for having me.
Up next, imagine being attacked by two dogs at once, both vicious. How one woman survived a terrifying assault, and what to do if a dog turns on you. Stay with us. We're back with dog attacks caught on tape. My next guest was out on her morning walk when this was caught on tape. Two dogs coming from across the street, right, and began attacking her on her own front lawn. There she is trying to run away, right? But she fell. She fell and they jumped on her. Rhonda, the woman in that video, joins us now via Zoom to tell us how she survived. Now, Rhonda, we just saw these dogs, they're charging after you out of nowhere. What was going through your mind when that happened?
I was thinking at that point, where do I go? What do I do? And before I could complete that process, I was being attacked. And as the dogs began, they started on my lower extremities. The brown dog came all the way up to my throat. I could literally feel his breath on me, and I could just smell it. across the street, luckily, the neighbor's dog came and chased them off. I was eventually able to get up, run back to my home, and get in the house. But at that point, I still didn't feel safe. I still do not feel safe today. But what I also know is that through this process, I'm still committed to living my best life, because my life has honestly and truthfully changed forever.
Yeah.
But I'm committed to living my best life and overcoming this obstacle.
Good for you, Rhonda. Thank you for joining us. Let me bring in someone who has insight into a dog's mind. Trainer and animal behaviorist Victoria Stilwell, bringing my little Khaleesi here.
Hi.
I'll take
Hello.
Khaleesi. So, you know, in your experience, what triggers these kinds of attacks from dogs? It's so foreign to me, but 1 in 70 of us, even in my audience, I polled folks in a little break, it's more than that, have been bitten by a dog.
These kind of attacks seem to me to be more like predatory behavior. But in general, dogs will bite people to keep themselves safe because of fear, because they're protecting resources, because they're in pain, or for some other medical reason.
Let's walk through this. Some of the reasons that a dog, come on, Khaleesi, may feel territorial. A dog may want to protect themselves, or because they're in fear, act out.
Yeah.
So the first is, these are all pictures I want you to memorize. There's a growling or snarling dog.
Yeah, and growling and snarling, all of these showing teeth, they are warning behaviors. So those are very overt signs that we recognize, we back away. The next one.
Showing the teeth, look at them, I mean, they're...
Showing those teeth.
Khaleesi, don't do that, Khaleesi.
And snapping.
You don't want teeth like that.
Yeah, that's like a warning sign as well, showing teeth. They're all telling you back away, back away, back away. And then the snapping sometimes is also a warning.
And then the rigid, snapping, I guess they're purposely missing you, right? They don't miss you by accident.
Well, sometimes they do, sometimes they don't. Sometimes they show an inhibited bite, sometimes they miss you, get out the way. So, but here is where the body language that you have to look for is sometimes the body is very stiff. The tail is very rigid, but you can also have tails that wag very quickly back and forth. There are also some signs that are much less, I would say, well, very subtle, that a dog is uncomfortable. There's a lip licking, when a dog yawns. If you go to greet a dog, a strange dog, and the dog goes on its back and shows you its belly, it's not saying, rub my belly. It's a cutoff signal. It's saying, don't come near me. I don't want to have interaction with you. And that's why a lot of people misconstrue.
I would think that would say, because if Khaleesi did that, I'd scratch her belly.
She knows you, right? So my dog loves having her belly scratched. But if it's a dog I don't know, and I'm going up to that dog, and that dog flips over on its back, quickly, I know, leave it alone.
So what should you feel, what would you recommend that we do if we're in a dangerous situation with a dog? It's there, we're here, how do we avoid a problem?
Oh, it's really hard. Stay calm. Don't stare at it, and try and be boring. I teach a lot of dog bite prevention to children, and I teach them be boring, because then you're not fueling the fire. You're not exacerbating any kind of anger, frustration, or predation that the dog might have.
What if the dog's already attacking you? It's already lunging at you.
Yeah, and this is very, very scary. So, look, we are pre-programmed to survive, all right, as our dogs are. We will do what we need to do in order to survive. We will fight. If you have a piece of clothing you can put over the dog's eyes, if you have a bag you can put in between you and the dog, if he gets you on the ground, he or she gets you on the ground, you can roll up like a stone, protect your neck, protect your vulnerable parts of your body, hope that help comes. And here's the thing, if the dog is biting you, pull the sleeve, or if, for example, this is the dog biting, instead of taking your arm away, feed your arm into the dog. Because what happens is that when the dog's biting and you're trying to take your arm away, which is our instinct, it's going to rip the skin. Yeah. You put your arm and you feed your arm into the dog's mouth, it's going to do much less damage. But that's hard to do. Yeah,
but it makes sense. You get puncture wounds rather than huge pieces being ripped off, as we just saw in the earlier segment. Remember, everybody, dogs don't want to attack. They rather cuddle and play, like Khaleesi here. But I think we're better off with our dogs by far. And if you know them, scratch their belly. Otherwise, I learned something from Victoria. Be careful. All right, we'll be right back. Thank you. Up next, unbelievable health nightmares, from paper cuts that turned into a life-threatening emergency to a runny nose that lasted for months. Find out how one woman thought it was just bad allergies. Turned out her runny nose was from fluid leaking from her brain. We've all suffered the pain of a paper cut, opening an envelope, grabbing papers too quickly, and it usually heals within a day or two. But for one woman, her paper cut turned into a shocking health nightmare. Within 48 hours, Heather's tiny cut on her pinky turned into this. She found herself in kidney failure, fighting for her life. What could have caused such a little paper cut that turned into a big health emergency? Well, Heather joins us now via Zoom. So Heather, how did you first cut your pinky finger, or orient us to what was happening?
Hi, good morning. Well, we were moving actually from one side of our island to the other. And in the hustle and bustle, just being busy, unloading boxes, cleaning and whatnot, I noticed a tiny cut in between my ring finger and my pinky. And it started swelling. The pain was just so bad. And then within hours of that, I got a fever. And so they diagnosed me with necrotizing fasciitis.
So let me show some of the photos of what the paper cut did to your hand. So I'm going to put a red circle here. We're showing a picture of your pinky where the cut was. And then the early stages of the flesh-eating infection are evident here. You can see the skin's discolored. And it's, pretty aggressively moving along. This happens very quickly, by the way. And then after the surgery, they removed the infection and they sort of sewed you back up again, but it was still very swollen. So Heather, when doctors were doing all this and trying to save your life and your hand, what did they say was causing all the swelling in your hand and your arm?
So basically, it was a flesh-eating bacteria that was eating through all of the tissue. By the time I got to the hospital, it had already eaten all the way through my tendons. And basically, I was going into kidney failure. And I was really, if they couldn't stop it, amputation was the first step. Otherwise, they were going to try to at least get as much of the infection and save my arm and my life.
Let me show you why you were diagnosed with necrotizing fasciitis and what that really is. It's more commonly known as flesh-eating bacteria, and it can start with just a scrape on, for example, in this animation, your leg. And in Heather's case, it was a tiny little cut in your hands. These bacteria, let's just say they're these green things on the surface of the skin. There's the cut there in the blood vessels, but the green bacteria come in from outside, and once they get in contact with the wound, there's no protective barrier. They just spread out. They create all kinds of infection and inflammation in the surrounding area. That's why it gets red. And then they start to cause closure of blood vessels, thromboses. And these can be devastating because they shut off all the blood supply to the area that's infected. That's why you get parts of your body, your legs, feet, your hands, arms, they start to turn black. That's what this flesh-eating bacteria ultimately does. And ultimately, once it infects your extremities, it'll put your entire body into a state of shock, which can cause the vital organs like the kidneys and the heart to shut down, as you were describing. So Heather, you're not 100%, you're not sure exactly how you got this infection, but give me your best guess.
Well, the rain water is caught most times in Hawaii for bathing, cooking, just washing dishes and whatnot. We don't drink it, but there's big catchment tanks and we catch the rainwater. And I believe that the rainwater had bacteria in it and it just made its direct entry through that little tiny cut. And that's what got me.
Can you believe that such a tiny paper cut led to such a gargantuan health nightmare?
Gosh, I was shocked that something so minor would, almost cause me to lose my life. And, it really was something very shocking and just happened so quickly. But I thank all the doctors that saved my life and, especially Dr. Pereira for, re-healing my hand, basically.
Well, I'm glad you're doing well. Thanks for sharing your story, Heather. Whenever I get a paper cut, even if it seems tiny, here's what I do. First off, you wash your hands and you clean the wound, the basics, what your mom taught you to do. I would just rinse it with warm soap and water. You don't have to put lots of chemicals in there. Then dry it thoroughly, cover it with a bandage, and just let it be for a while. It'll heal. Up next, another health nightmare that will shock you. One woman discovers the fluid running from her nose isn't snot, but rather brain fluid that's leaking. Stay with us.
The public outrage facing rapper T.I. stand on the controversial virginity test.
I think he did it out of protection.
It's up to you. It's your choice, your body.
We're weighing in.
It's a wake-up call for the entire nation. That's coming up Friday. We are back with unbelievable health nightmares. Now, we've all had a runny nose, going through boxes of tissues due to a cold or allergies. But what if your nose wasn't running because of snot? Andrea's nose was dripping for more than 7 months before she learned that it was coming actually out of her brain. It was brain fluid coming out of her nose. Andrea is joining us now via Zoom. So, Andrea, when you first started noticing that your nose was running, you were told it was bad allergies, but then it got worse. So please help everyone understand how much fluid was actually coming out of your nose.
Well, it started out dripping, and then it went to pouring out of my nose. So I went from tissues to paper towels, and I had to put them up my nose because there was just so much fluid coming out.
Oh my goodness. Now, when you went out, what would you do? You just keep blowing your nose?
No, I always had tissue in my hand, and I could kind of feel when it was going to come out. It would kind of build up, and then I could feel it. So I would just quickly put a paper towel there, or try to catch it without anyone knowing. I hid it pretty well.
Did it have a taste or a smell? What did it feel like?
It looked like water. It was tasteless and odorless. There was no color to it at all. It just looked like water.
And you see other symptoms then started to turn your life upside down. So how did your health nightmare get even worse?
Well, the whole time I had a sinus infection. So I started going to doctors, urgent cares, ERs, to try to figure out what was going on. And they all just said it was allergies. So I had to sleep sitting up, because if I laid flat, the fluid would go down my throat and I would wake up choking on it. So it felt like I had pneumonia. My chest was real heavy, and I had this horrible feeling that I was dying.
Oh my goodness, that's never a good feeling to have. So you actually were able to find an answer, and there are a lot of people who probably have a story similar to yours who have no idea. Let's meet her neurosurgeon, Dr. Michael Lemole, who's actually the surgeon who saved Congresswoman Gabby Gifford's life when she was shot in the head in that horrible case in Arizona. He also happens to be my brother-in-law. How'd you diagnose Andrea with her leak of brain fluid?
Well, Mehmet, after we collected some of the fluid from her nose, we were able to diagnose a spontaneous cerebrospinal fluid fistula, or CSF leak. Yeah. And a CSF leak is when some of the watery fluid around the brain is able to go through a defect or a hole to escape to the outside world, usually through the nose or the ear.
So here's the thing. These holes can be caused by injuries, they can be caused by car accidents, they can be caused by surgery. And your sister, my wife, Lisa, when we were first married, banged her head against the stairs, actually, interestingly, the under part of her stairs when she was getting something from a closet. And then she had this weird metallic taste in her mouth for a long time. That's typical?
Typical for CSF leaks.
Yeah, and when she went upside down, it would get much worse.
Yes.
Why didn't you tell us? now he's helping. You couldn't help your own sister.
A bit more education since then.
All right. I want to thank Mike, actually, because when Lisa gets really mad at me, he protects me. Otherwise, it'd be curtains for me. So to put this in perspective, this is as much fluid as our brain makes in a day, roughly, about half a liter, roughly. Mm-hmm. So how much would typically come out of your nose if you were actually leaking?
In severe cases like Andrea's, you could literally fill the palm of your hand. However, it doesn't have to be that way. That's what's so frustrating. Some of these cases are so subtle that you might not see it right away, and it could take years to diagnose. But in Andrea's case, in Lisa's case, you really need to meet 3 conditions for this to happen, to have a leak through your nose. You have to have a tear in the lining of the brain, called the dura, the thick leathery sac that surrounds the brain. You have to have a hole in the base of the skull, and you have to have a breach in the lining of the nose. And when all those come together, you have a leak. And like you said, that can happen from tumors, from trauma, or it can happen for no apparent reason, like in Andrea's, an idiopathic case.
And it'll look like this. So again, it come right out of your nose, and when you cough or sit up, it'll come out like that.
Right out like that. We'll actually ask the patients to lean forward like they're sniffing, and you'll see it literally come out dripping like that in severe cases. Yeah. And if they don't heal on their own, like Lisa's did.
If you see this, by the way, please call somebody.
Yes.
Right?
Yes.
This is not a runny nose from a little flu.
That's not normal. And if they don't heal on their own, then we have to consider surgical options, like putting a video endoscope up your nose, looking for the hole, finding it, surgically repairing it with our ENT colleagues.
And is that how you repaired Andrea's?
That's exactly what we did.
So Andrea, what did it feel like when that fluid was finally fixed? It wasn't leaking anymore from your brain?
Oh, I had a chronic cough. I had really bad chest pain. I was exhausted, and really dizzy, kind of in a fog. And I had a lot of sinus pressure. So once it was fixed, it was like night and day.
Oh my goodness.
Night and day.
And Michael, if you hadn't gotten to Andrea in time, what could have happened? Because you're not supposed to have a breach in the most precious part of the body, the area around your brain.
And the symptoms she had were dead on. The brain needs to be bathed in this fluid. Not only does it provide nutrients and take away waste, but it literally provides a liquid cushion to sit on. And when you drain too much of that, like Andrea did, the brain sags, the lining stretches, it gives these terrible headaches and symptoms. But the most feared complication is meningitis. And that's when the bacteria from the nose literally migrate up through that defect and inflame the lining of the brain or the brain itself. And if untreated, in worst case scenario, this can rapidly proceed to death.
Oh my goodness. Andrea, you feeling okay now?
I'm feeling a lot better. I take it day by day. I am on disability now because I do have chronic migraines and chronic facial and sinus pain, as well as anxiety following the surgery. So I have my good days, I have my bad days, but my family and my faith keep me going. And I'm just really thankful to Dr. Lemole for everything he did for me. And I'm still able to be here with my kids and my family. And I'm just very grateful that I'm sealed, no longer have a CSF leak.
Sealed and healed. I'm glad it worked out. Congratulations, Andrea. Mike, thanks very much for being with us.
Thanks for having me.
All right, we'll be right back. Up next, hip-hop royalty are here. Rev Run and Justine Simmons open up about faith and marriage, and they weigh in on the biggest battles couples face. They're caught on tape. Who you be on? Team Rev Run?
That's me. Yes, me.
Or Team Justine?
Woo, that's me.
No, it's me.
We'll find out.
Me.
Here's a music mogul and a minister. She's a media maven and the boss behind the scenes. And together, they are hip-hop royalty. Rev Run and Justine Simmons are here. They open up about their marriage and the power of faith and how they healed from a health emergency they never thought would happen to them. Come on out, my good friends. Rev Run and Justine Simmons.
I want to do
Burger, fries. One more time. Burger, fries.
How are you?
I love you, Justine.
Are you in the middle, right? Okay, I'll go.
I love this. He's producing, directing.
Courteous. Make sure the ladies first.
Well, thank you very much.
you for that.
You know, before we came out, we were talking about how to greet each other.
Right.
And of course, people who are affectionate towards each other want to hug and kiss. But I like this burger fries idea.
Burger?
It's got a little something going there.
Yeah.
It works.
I just did the elbow quick bump.
The elbow's so easy, you don't hurt your
Like,
hand that
boom,
way.
yeah.
When guys fist bump, it can be painful.
It
You can.
Yeah.
Because I'm always encouraged by folks of faith, and I saw this wonderful quote on Instagram: God has a bigger plan for me than I have for myself. Rev, you posted that. What inspired you?
Just thinking about everything that was going on around me. What's next? How do I handle the kids? I'm gonna do the career. We did the Grammys. All these different things that are coming at me, and I wanted to know, okay, what's next? How do I? And I had to take I out of it and said, he has a bigger plan for me than I have for myself. That also encourages you.
Yeah. Going somewhere.
You start to think, you know, okay, I want to do this, I want to do that, I'd like to do this. But what about the times when you let go and then it comes out better than you thought it would?
So faith is a big part of marriage, so I'm going to test your faith at Rev. Does he have anything he does that tests your faith?
Oh, doctor.
Just, I want to hear the truth there.
Okay.
The nitty-gritty, because when you live in the same place, it's not always in harmony.
Exactly. So, Dr. Oz, he has this thing where, and why would you do this? Take off your robe and put it on the floor.
What?
Who
Really?
does that?
A man of faith?
You gotta listen to the whispers so you don't have to hear the screams. So,
Yeah.
first it's like,
I say, Joey, don't put your robe on the floor, babe.
and if I don't listen, then what
I
happens?
go, Joey.
That's the scream.
You
That's the
know.
scream.
You gotta, in order to have a marriage, you have to listen to the whispers so you don't have to hear her screaming about the robe.
So part of the reason I wanted to have you guys on, they have a wonderful new book. It's called Old School Love.
Yes.
What does that mean, Rev?
Old school means love is a grown-up thing. Grown folks' business, I like to say. Old school, opening car doors. Old school.
Holding hands.
Holding hands.
Things
Old
that they
school
did
being
back in the
courteous
day.
before the divorce rate was crazy. So I believe that biblical principles that are in this book and some of the ways that we describe them will work. Like, don't go to bed angry. People think that's cliche.
Yeah, I used to.
But that's a
it's
scripture.
not, because the more we found out, the more you can be angry at somebody, the more you can stay angry. So that one
It
day
feeds itself.
Exactly.
That's an old school principle.
But
how
people
can two walk together unless they agree? So that means, and that's in the Bible, that means that love is not so much looking in each other's eyes, but it's looking in the same direction.
Oh, I love that.
Yeah.
I love that. Not looking in your eyes so much, but looking forward the same
It's the
direction.
same way. And if you get on the same page, you'll have a great marriage.
So you've had challenges in your lives, and a lot of times people are pulled apart by the challenges. You lost a child.
Yes.
Which is the most painful thing I think any couple can experience. You lost a daughter a few hours after she was born.
Yeah.
That's heavy.
And you said that you felt lonely for the child
Yeah.
for a while.
Well, believe it or not, Dr. Oz, before we decided to have a baby, I went to Joey and said, do you want to adopt? And then he said he prayed for wisdom, and God made him
reminded
him.
The first thing she wanted to do was adopt. So when I went back to her when she got home from the hospital and said, babe, let's adopt, what happened?
Literally, all the pain went away.
A lot of couples see their marriages dissolve in front of them with that kind of adversity.
Yeah.
You think you're cursed instead of realizing there's some deeper wisdom there.
It reminds me of a basketball team. If they start arguing within, the team falls apart. We've never considered when stressful situations come, doctor, when things are bothering us or things hurt, that to fight each other. Yeah. We're always like sitting together trying to fight the opposition, the thing that's coming at our marriage. So that's in all facets of life, not just in this particular situation, but in every situation that comes at us.
We're the team.
If I'm stressed, like, oh God, thank God I got Justine as a wife. Yeah.
See, my wife learned martial arts so she could express herself to me differently.
Well, you don't want to get in the middle of a karate chop, though.
No, it happens, believe me. All right, up next, Rev Run Justine can break down some of the biggest battles that couples are facing. And guess what? We caught them all on tape, so you don't want to miss it. We are back with Rev Run and Justine Simmons, and we're about to reveal the biggest battles couples face caught on tape. Let's take a look at our first couple who volunteered.
So I came home the other day and I overheard Nicole on the phone, so try not to make too much noise, until I heard my name. So I listened a little closer, and this girl is in there talking about us, talking bad about us, talking about me. Girl got the nerve to call me cheap. So I had to do a little investigation, for my own personal information. I went in her phone and I found all these text messages. I could not believe it.
He couldn't believe it, but he's here. David and his girlfriend Nicole are joining us. How did Nicole talking about you behind your back affect your relationship?
It annoyed me. It makes me very uncomfortable. It puts a lot of pressure on me, as a matter of fact.
So you actually mentioned the texts. I'm going to share them with the audience. Is that okay? Everybody, all right. So here it is.
You did it.
She texted, he did that thing again. Insert eye roll here. And then Nicole went on to say something that's a bit more provocative. I think I should say something. The Groupons and coupons are not the wave. It kind of aggravating me.
Really? Yeah.
So Nicole, why do you turn to your friends to talk about things that are bothering you in your relationship?
I mean, I talk to my close girlfriends because I just want a safe space. I'm thinking it's private. I just want to vent. I don't want to hurt his feelings. I just want to get it off my chest.
Was he like this when you met him?
Keep it real.
I didn't
notice?
No. I didn't quite notice so much. Oh. There may have been little
so the
things
coupons
here or
came
there.
Later.
Yeah.
So you started coupon snipping later.
No, were you like that when she...
Were you always frugal?
I always have a plan.
Okay.
I keep things a certain way. I like to keep orderly, and if this is the way that works best, I see no reason to...
Right. That's one thing, Doctor. So we have to realize when we're in that dating stage, if that's a red flag for you, then you just move on. A lot of times we just want to, okay.
Hope it away.
Yeah, hope it away. Yeah. So now you have to meet him halfway with this.
Well, Nicole, I got to say, the most important thing that I've heard this wonderful couple share, in my marriage as well, you better be clear and honest about it, because if you hold your feelings now, you're just hurting David.
Absolutely. We got some things to talk about. We will.
All right. All right, now, you guys stick around because you want to hear this next story as well. This is our next couple's battle. Someone in our audience is about to get surprised by what was caught on tape.
My boyfriend Roman and I made this pact to get into incredible shape together. We're an awesome couple. We motivate each other. He's got an incredible body. We would just want to do this together. No chips, no cookies, no carbs. So we made a pact. Let's do this together. Well, I feel a little betrayed right now because I just found some little secrets hidden in Roman's truck. Chips, 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 more chips. This chipaholic is going to send me into a carb coma. I am so upset right now.
Well, Roman, you look like a gazelle, but...
Did he notice it's coming?
No. Are those chips yours?
No.
That was
No.
good.
Who are you hiding those chips from? The dogs? I saw them back there playing.
Yeah, I guess they gave me up. Yes, they're mine.
They're yours.
Busted.
Why does it bother you so much to have the chips in it?
Because we're supposed to be doing this together as a team and getting in shape together, and I want him to motivate me, and how's he going to do that if he's sneaking junk food behind my back?
So it seems pretty innocent, but let's just talk about this. How, since something as seemingly minor as hiding things from each other, turn into something much more important?
Let's ask Rev about that.
Well, I have M&Ms in my drawer, so as far as
Last night, what happened?
my grandson, I told him, I said, I got some M&Ms for you. She said, no, you don't. I said, yes, I do. And I kind of busted myself. So the keeping secrets, I'm not that good at really helping this couple because I'm him. You know? So, but if it, on a true level, on a real level, not just on the cookies and chips level, which I'm guilty of, hiding situations from each other is not healthy.
Yeah.
I mean, I do let her know. Like, if I'm eating something that's wrong, I'm not really hiding that much of it. I'll just do it in her face because she's been off carbs for a minute. And she's like, you're eating extra carbs now. Everything's pizza and cake.
Dr.
So at
Oz?
least I'm doing it in her face.
No, Dr. Oz, I can't have carbs.
But you made that up for yourself. We wasn't in it together like them. I didn't say I'm off carbs.
I'm listening.
No, we're not helping them.
No, they're learning from this. This is an intervention.
Yeah.
You are the actual intervention here.
He's not on carbs. But why do the dessert all the time now? You understand? He didn't do that before.
Yeah, why do dessert now?
I think as she got rid of carbs out of her diet, I just got a sweet tooth out of nowhere. I don't know. But at least I'm not hiding it. We're at dinner. I'm like, give me the lava float.
But if I say, okay, now, he said, give me the lava float.
Dr. Oz, what are you doing?
And I said, he's going to help us. And so I said to him, well, I don't want anything. So that's when he was like, told the lady, come on over. So then when it came, I said, like I was gonna.
And I was like, oh, you're off carbs.
And then, no, wait, yeah. He reminds me, and I said, yeah, but I might want something. He said, you know what, Jess?
Forget it.
I'm not gonna get nothing.
Oh. So it helped.
You see what I'm saying?
So you pulled me towards you by saying no.
Yeah, but you just didn't want me.
Did we answer their question?
Sorry. Okay.
You know what? I think you just did fine.
Okay.
I love you both dearly. I hope that was helpful for you. Thanks for being a good sport. Listen, there's a lot more of this in their wonderful new book, Old School Love, as always wonderfully done by this beautiful couple. And guess what? You're all going home with a copy. You get a copy. You get a copy. That'll really help you. We'll be right back. Here's the question for everybody in the audience. Everyone at home, think about this. What kind of a chicken wing eater are you? Are you a 1, right? Where, I don't know, took one little bite, didn't like it, I guess. 3's, middle of the road. Are you a 5, where, there's just the bone and barely? Audience, which of the choices are you? Let me see you. We got 1s, 3s, 4s, 5s. You're a 1? Mm-hmm. Really a 1?
A 1.
You don't like the...
I really don't eat them.
You don't eat them?
No.
All right, so what do you think of people who are 1s? Like the lady behind you.
They obviously don't like chicken wings.
There's a 1 over here. You don't like him either?
I like chicken, but not the bone.
Not the bone? All right, 1s,
I'm a 1.
Just one bite and let it go?
1 bite, yep, that's it.
I gotta say, the food quiz has elicited hilarious reactions from social media. Chrissy Teigen tweeted, "I don't invite 1s or 2s back to my house." Right? Even my daughter knows better, she says. And I have to say, when I indulge in wings, I would never be a 1. I gotta eat everything. Just get to the 5. If you like them, you like them, right? Am I right? Where are the 5s here? All right. So Anaya is a 5, right? And she's joining us here. She's gonna show us a technique for achieving 5-dom. Are you all ready to watch for the 1s out there? All right, let me see how you do it.
Wait, first, did you say 5-dom? That's hilarious. Sorry.
5-dom.
So you have to dip it first, Dr. Oz.
Of course, everyone,
Of course.
please.
And then you
work your way around.
Mm-hmm.
You take your time.
Take your time, because you have to savor the moment. You can't do too fast, because then you don't taste it.
And when you're done, it's just the bone.
Just the bone.
Oh, from the end, you're eating it.
Mm-hmm.
Why waste time? Oh my God, it's almost over. It's a 4 already.
I'm a Caribbean woman. Sorry, and I tell people all the time, I thought this was the norm around the world. But to see the 1.
Well, we got 4s and 3s around you, so you're safe. You keep finishing. Remember, everyone, the power of change lies in the power of you. Just one person, one voice speaking the truth, and you can all be 5s. There it goes.
There it is.
Goodbye, everybody.